Inclusive Research Podcast. I'm your host, Dr. Ren, founder of Diverse Research Now. And today you will hear the voice of Zachariah Martinez. Zach is a 13-year-old from Southern California, and he is here today to share his experience participating in a pediatric clinical study. He loves science, health, and helping others. And I'm just super excited to have Zach here today. His mom is a dear friend of mine, and I really just wanted to get his experience on record because we don't always hear the experience of our children that are participating in research. There are children participating in research, and we need them to. I want to thank you ahead of time, Zach, for your time today and just really sharing with us your experience. So, how are you doing today?
I'm doing pretty good.
Good.
I've had a pretty good day, yeah.
Yay! I'm so happy you had a good day. And so happy it's Friday. Get a little break. Okay, so tell us more about the study that you were in. I think it happened a couple years ago, right? When you were
About a
around
year.
11 or
Yeah.
so.
Yeah,
Tell us
around
more.
one.
Say it
So
again.
I was in the motor pack study. So it was the study of like exercise and children and stuff. So it was like ages 10 to 17 and stuff. And basically we were getting recorded and stuff like when we're exercising, like what happens and basically stuff like that.
Uh-huh.
And
Go ahead.
and then you can
Oh, and I was gonna ask you how long were you in that study? Was it
I would say about initial part of the study was like 5 weeks long. I would say there was the beginning, and then there was a 15-week or 12-week period around that, and then there was another 5 weeks at the end. So I would say around
okay?
20 weeks, I would say.
Okay. And then how often did you have to do something with the study? Was it like every week, every other week, every month?
I would say it was around Monday, Wednesday, Friday in
Okay.
like the 12-week area, but then like every 2 weeks for like the beginning and the end.
Okay. I know a lot of times parents are worried about these studies kind of interfering with your school day, homework, different things like that. Did it interfere at all with any of that?
Not really, actually. I sometimes I'd be a little tired, but it mostly was just like keeping me happy and stuff, to be honest.
Uh-huh. Now tell me why you got involved in this study. Did your
So
parents influence you or
basically, my friend from school was doing the study, so I
Oh,
joined her and we got to like do some things for a while and stuff. And yeah, it was pretty fun.
that was super cool. So you heard about it from another classmate
Mhm.
and got involved. I love that. I love that. That's great. That's how that works. So were you gonna say you were in another study or was it another study or was that the only one?
I think that was the only one, but I think there might have been a second study, but it was yeah, like a sleep study.
Oh, you were in was this the same or this is the same research company that you did
Yeah,
this?
it's the same research. Yeah, same.
Okay. When the sleep study, because I know that sleep studies, you usually have to go and like spend a night at the hospital or something like that. Was it kind of like that?
Yeah, it was kind of like that. I was
Uh-huh.
hooked up to a bunch of like wires and head
Yes.
caps on my head. So it was
Yes.
like everywhere. It was like, but it was really fun. I enjoyed it.
Yeah. What was like when it all ended? Did they give you like results or like tell you how you did or
Yeah,
like what did you get any feedback?
yeah, we got like an entire sheet of paper with all the data and stuff. And it was really interesting. We got to see like how much like fat I've lost, how much my bone density, a bunch of stuff like that. It was really
Yeah.
interesting.
I bet you that this was super exciting for you because you like science. I read in your bio that you love science.
Yeah, I'm pretty good with science, I would say. No.
Good. I love this because a lot of times clinical research is not really like taught. I mean, okay, wait a minute. Actually, let me ask you that. Did your science class teach about like clinical research and like how clinical trials work and stuff?
Not really.
I didn't think so because I feel like I didn't learn learn about it until I was like an adult.
Yeah.
Like I didn't really know anything about clinical research. So one of the things that we're trying to do diverse research now once make sure we do in the future is really spread our mission and our message to children of your age because you are the future. You're gonna make the difference in all of this. I might not see the change happen. You know what I mean? I'm not that old, but I might not see it happen, but you guys are gonna carry it through. So I definitely want you all to know about diverse research now and like why it's so important to have people from all backgrounds involved in research. Have you ever thought about that? Like why that would be important? Like having people from all like different backgrounds.
Yeah, I feel like that's important because we all have different perspectives on how these things work, and I think it would really help a lot.
I love that. I love that. I love that the different perspectives. You are so right. Like we all have to come together and make sure we're coming up with drugs that work best for everybody.
Yeah.
So that is so important. So tell me, would you be in another clinical trial? Like do you have time for it? I know you big 13 now, so
Yeah, I have time for it, I would say.
if you were going to be in another trial, in another study, kind of what studies would you get involved in?
To be honest, I would really go want to go back to the study again. I really like the sleep study, but I feel like that
Mhm.
stuff in general I really like. Maybe some other stuff, but I think that's like really it. I
Mhm.
like those studies, so they're really enjoyable.
Yeah. Now I know you said that your friend told you about the study. Did you tell your any other friends about it and did they get involved? I'm curious.
I did tell a few actually. Basically, back in sixth grade, we learned about something. I forget what it was, but I had basically had to go in front of the class, and I had told my teacher about it. So then she
Oh,
told me to tell the entire class. And I also had
oh,
a couple of friends that were also interested in the study.
oh, cool. I wonder if they got involved too. I think that's awesome. I think word of mouth is huge. I was just actually talking to someone else about like the snowball effect. Like you tell one person, they tell the other person, they tell, it definitely like helps. And it sounds like it's even effective for your age group to tell
Yeah,
your friend, tell your friends and they tell them and it can keep going. I'm curious to know, were there any financial benefits? Like, did they have like a gift card? Did you get a gift card or anything?
I actually got paid, I would say around 250 bucks every time I went.
Okay.
I would say. And I think I gained about over $800 from the entire thing, maybe a little more.
Well,
And
shoot, that is a motivator.
yeah,
That's
and
super. Like, we don't want to call it an incentive because, of course, we needed you in that study. So that money was for your time and your effort. You have been science, right? But I mean, that's a total benefit, right? Total
yeah.
benefit to getting involved.
Also from the sleep studies, I would say it might have been a little bit more. I would say maybe even over $1,000. I didn't really like know how much I got in the end because
Yeah.
I was like it was somewhere in my bank account or something.
Yeah.
But yeah. Also we did get like food like for doing things. So they would get us food like after a sleep study, let's say for dinner, they would get me food from any
Nice.
place I wanted. And
Excellent.
also for like getting you had to get your blood drawn in the like beginning of the study and at the end. I would say it was like kind of intense at first, but I got used to it, to be honest, after the first time.
Mm.
And in the second time, they didn't collect all the blood they needed because the like pipe things clogged up. And so I still got like all the money from the thing, but I just wasn't able to like get all the blood that they needed. But
Okay.
they still got me the food I wanted, and I
Of
really enjoyed the study.
course. Yeah,
It was
that
fun.
happens. It happens. It even happens with adults. Sometimes, you can't get the samples that you need, but you still have a right to get those benefits because, again, you're helping to move science forward. We need you to help move science forward, to come up, to find solutions to things. Sleep is huge. So, thank you for being involved in that. That's a huge thing that people struggle with, and it definitely affects your brain. I talk about brain a lot, brain health a lot. I know your mom talks about brain health a lot. So we definitely have to like find answers. It makes sense to have like people from all ages because we don't really know how far back it goes. Once we start having problems, like we don't really know how far back it goes. So it's just so important.
Yeah.
Really, really appreciate you. You said that you would get involved in another study if you could. That's awesome. Tell me what you would tell other kids out there. Like if there was other kids listening in to this conversation, what would be your advice to them? Tell me, and how would they find? I don't know, how did you find the study that you okay, no, you said your friend told you, so it was easy to find. But that's actually something that diverse research now can help with. So like even if now you wanted to get into a study, we could actually help you find one for you.
Yeah.
Um,
So the study was at UCI, so I
oh, okay.
definitely recommend getting contact with them.
Uh-huh.
But I would recommend to all like kids who want to do these studies things like
Yeah.
if you're like afraid of needles, you don't have to do it, but all this stuff it was really good. Like it helped me. I actually noticed and my family noticed that I was getting happier when exercising and doing this study.
Ah,
And it was really interesting and stuff. And I recommend it to all kids to be honest, because it really helped like my whole like routine. I
yeah.
was happier and it was really fun. And I recommend it because it's a fun thing to do and you get really good benefits from it.
And it helps everybody, Zach. It's so rewarding because you not only helped yourself, but you're helping the future. And I know that was one of the things in your bio that you like helping others. So that is so amazing. So if you're out there and you are around Zach age or even younger, I mean, we have studies for babies because every medication, even if it's a medication for a baby, have to get proven to work and be safe. So we have research studies across the board for children. But if you're out there and you're looking to get involved and help other people, that's a great way. If you love science and you want to help collect data on certain things, like that's a great way to get involved. One of the things, so I hope you're on my list this year, Zach, because every year, diverse research now, we give away toys for kids that have been involved in research. So I hope you're on my list this year because we want to continue to give back to you for moving science forward. That's what we say. You're helping to move science forward. We need that. So, anything else? I think I wanted to ask your experience with the staff. What was your experience with the staff? Were they cool? Like, did they help you or did you not like them? Like, what was going on with the staff of these studies?
Actually, everyone there was really kind, and I really
Okay.
like enjoyed everyone like felt like they were friends. It was really like interesting. Runner, I think, of the entire thing. She was really nice. Everyone was pretty nice there. I
Uh-huh.
really enjoyed being around them, and I really enjoyed the study in general.
Okay, good, good. Okay, I just want to make sure because the people that's actually doing the study is so important. Like, you want to feel comforted because, hey, like they're taking your blood. Like, you got to be poked and prodded. So, you want someone that's going to actually give you a smile, right? Like, so I feel like that's super important, especially with pediatric studies. Like, we need the children, we want you guys to be comfortable and be relaxed while you're going through the study. So you need a staff that is going to give that, be that for you, give that energy, that comforting energy to you. That's good. I'm glad to hear that. I'm glad to hear that. Well, okay, last question. Any suggestions? This is a big question because I asked a lot of my other adult guests this because we're really trying to push the needle forward, Zach. And I cannot wait to see what you do in the future when it comes to science. I know you're going to be in the science field some type of way. Maybe I should ask that. What is your aspirations? Like, what do you want to do later? Be when you grow up?
I always wanted to be a doctor. I don't know, I'll try. I've also been really interested in like the film industry, but I've
Okay.
also really interested in like biology and science and like chemical and engineering and stuff, engineering in general.
Mm.
So yeah.
Yeah, yeah, I hear you. Now you can do all of it, Zach. I want you to know that you could do all of it. You can go into science and you can like do some film too. Like, why not? You know what I mean? Like, why can't you do it
Mhm.
all? You can do it all. So I just want to encourage you that, hey, you can do all of that. But my question for you is for scientists and researchers that are doing like pediatric studies and even studies for adults, do you have a message for them as far as how to make sure they are considering everyone's voice? And like when it comes to like research, what the scientists and doctors are doing, they're answering questions, right? I know you probably know a little bit about research where research is where we're answering questions, like we're filling the gaps. There might be a gap in the research or in the data. And so we need to fill that gap. One of the gaps, so for example, one of the gaps that I'm trying to fill as a researcher is the gap of not having enough people from all backgrounds involved in research. Like, I'm trying to bridge that gap, get more and more people from all backgrounds, black and brown people disabled people, just people from all backgrounds need to be in research. I'm trying to fill that gap. So I guess my question is for pediatric studies, anything that you saw, like any critiquing that you can give to the researchers when it came to that study? Did you have any thought, well, this could have been done better? This could have been done better. Anything that could have been done better?
I don't really I don't think I have like a lot of critiques. I will
Okay.
say with the blood drawing thing,
Uh-huh.
I maybe felt they should have been a little more prepared or something. Like, I
Mm.
don't know if it was their fault or like the machine's fault, but I feel like they could have gotten all the blood. I feel like maybe they
Yeah.
hadn't done something. I would recommend like just like preparing for it. Like, I think they prepared, but I would just feel like maybe become a little more prepared. And also like
Hmm.
they asked me like if it was hurting and everything, if everything's okay. And
Yeah.
yeah, I would recommend to like all researchers like to just when dealing with kids or even adults in general, just like be
Hmm.
like, hey, is it hurting? Because you might not know, they might not say
Yep.
anything. That's the
Yep.
thing. You want to know if they're like comfortable and stuff, and also like
Yep.
be kind to them and stuff, and just like
Yeah.
in general, just because they're like some other type of person or from different
Yeah.
backgrounds, don't judge them.
I love that. Don't judge them. Yes, I love it, Zach. Thank you so much, Zach. I really appreciate your voice. You've made history. I have not had anyone of your age on our podcast before, so and you have been the first. So you made history today as the first kid on Voices of Inclusive Research podcast, and I really appreciate
Thank you so
it.
much for having me.
You're welcome. All right. Take care, okay?
All right.
Okay.